Here is something most families never think about until it is too late. When a loved one is diagnosed with heart failure, the first hospital stay feels like the hardest part. But statistics tell a different story. Nearly 1 in 4 heart failure patients returns to the hospital within just 30 days of discharge, not because their condition worsened overnight, but because the warning signs were missed at home. Here is what those warning signs actually look like. Sudden weight gain of 2 or more pounds in a single day. Swollen ankles that feel tight by afternoon. Shortness of breath when lying flat. Unusual fatigue during activities that used to feel effortless. These are not minor inconveniences. They are your body sending urgent messages. Managing heart failure at home requires a daily rhythm, consistent weigh-ins every morning, fluid intake tracking, sodium awareness, and knowing exactly when to call a doctor versus when to call 911. It also requires someone who truly understands the difference. Family caregivers often carry this responsibility alone, without clinical training, without a clear plan, and without the confidence to act quickly when something feels off. That is precisely where skilled home healthcare changes everything. Trained nurses monitor vitals, recognize early decompensation, coordinate with physicians, and teach families how to respond before a small symptom becomes a crisis. At Humanity Healthcare Services, we specialize in keeping heart failure patients safely at home, out of the emergency room, and living with greater dignity and independence. If your loved one is managing heart failure, do not wait for the next hospital visit to be your wake-up call. Call Humanity Healthcare Services today at 857-251-2283.